Friends, today we should talk about MRI scan. What is MRI scan? When do we do it? And what is the importance? MRI scan is a magnetic resonance scan. There are strong magnets which influence the hydrogen ion present in your body. And this causes an image to be reflected on the screen. So MRI scan is important for soft tissues. It is not so important for bone. For bone, we do a CT scan or an X-ray. For soft tissues, we do an MRI scan. What they do is they do scans in different angles. So they do scans from front to back like this, and from one side to other side like this, and they do also do scans in this plane. So we get scans in all the planes, we study them and see what is the problem. This you can see is an MRI scan of the knee, and here you can see we have got different sections here, different sequences. If we scroll through this sequence, you see this is the kneecap here. As we go back, we see there is a lot of fluid in the joint, and we go back. This is the thigh bone, this is the leg bone, and what we start seeing here, this is the lateral meniscus, this is the medial meniscus, this is the ACL that you see, and here you can see the PCL. So you can see each and every structure very clearly based on these scans. You can also see the medial collateral ligament, the lateral collateral ligament. So does everyone need this scan? Answer is no. Not everyone needs a scan. What happens is when we see someone in the clinic, then we take their history, see what is the problem, and then we do a clinical examination. When we find that there is some kind of a soft tissue problem in history and clinical examination, then we ask for an MRI scan. Doing an MRI scan blindly, does it help? It doesn't help. Why it doesn't help? Because the MRI scan is a very, very sensitive scan. It can throw off so many of us by showing so many unimportant things on the scan, and eventually they end up being a big problem for some people because they start overthinking and then they start going and searching for it all over the net on chat gpt and everything, and it throws them off the line. So an MRI scan is important when clinically you suspect something, and when you find it on the MRI scan, when the MRI scan confirms it, then we can plan a proper treatment. Friends, not everyone needs an MRI scan. Not every problem needs an MRI scan. Don't get unnecessary scans and create a problem for yourself.